Have you ever wondered how understanding development shapes counseling? It's crucial for effective therapy. Today, we'll explore the importance of developmental theories in counseling. Developmental theories help counselors recognize growth patterns in clients. They anticipate developmental tasks, interpret behaviors, and choose fitting interventions. Let's break this down. First, we begin with attachment theory and the case of 5-year-old Liam. Liam has been referred for counseling due to separation anxiety. When Liam is dropped off at school, he cries intensely and is difficult to console. Liam's mother reported that she struggles as a single mother, has experienced anxiety and depression, and relies on her family for support. In understanding Liam using attachment theory, what might be happening for Liam? Attachment theory proposes that early caregiver relationships shape a child's expectations about safety, trust, and emotional regulation. John Bowlby proposed that infants form emotional bonds with caregivers that serve as a secure base for exploration. Mary Ainsworth later identified attachment patterns through the strange situation paradigm. Common attachment patterns include secure attachment, anxious avoidant attachment, anxious ambivalent attachment, and disorganized attachment. Attachment theory emphasizes that strong attachments lead to healthier emotional development and social skills. Attachment theory suggests that children develop internal working models based on early interactions with caregivers. These models influence beliefs about whether others are trustworthy or reliable, whether one's needs will be met, and whether one is worthy of care and love. Counselors should help clients explore how early caregiving experiences may shape current relational patterns, how clients currently regulate emotions, and how those strategies may have developed. Counselors should also avoid assuming that one style of caregiving or emotional expression is universally ideal, and consider that clients with neurodivergent profiles, e.g., sensory differences, autism, ADHD, may interact with others differently due to neurological differences, rather than relational deficits. Regarding potential interventions, it is critical to understand that the most important attachment-informed intervention is developing a safe, consistent counseling relationship. If Liam becomes distressed during separation in session, which intervention would best support attachment security? The best response is B, which invites caregiver participation and gradually increases separation. Next is Piaget's cognitive developmental theory, and the case of Sophia. Sophia, a 6-year-old female client, is referred to counseling because she believes that if she feels angry, something bad will happen to her. To understand Sophia using Piaget's theory, what stage and characteristic might be playing a role in Sophia's developmental behaviors? Piaget proposed that children construct knowledge through interaction with their environment. He identified 4 stages of cognitive development: sensory-motor, pre-operational, concrete operational, and formal operational. Knowing Piaget's stages helps counselors communicate more effectively with clients, enabling them to tailor strategies to fit each level of reasoning. For clients similar to Sophia, we understand that she is egocentric, engages in magical thinking about the causality of events, and has difficulty separating thoughts from actions. When counselors apply Jean Piaget's cognitive developmental theory, they focus on how individuals understand, organize, and interpret their experiences based on their current level of cognitive development. Piaget proposed that thinking evolves through stages, and that people construct knowledge through interaction with their environment. For counselors, this means recognizing that clients' reasoning, emotional understanding, and problem-solving abilities are influenced by their cognitive processing of the world. Piaget's framework helps counselors tailor their approach to match how clients think, understand, and construct meaning about their experiences across the lifespan. Therefore, clients in the sensory-motor, pre-operational, and concrete stages benefit from play-based and activity therapy-based interventions. Clients in the concrete and formal operation stages benefit from the use of concrete tools, cognitive restructuring, perspective taking that may occur in group counseling and abstract dialogue. How should the counselor respond? The best response is B, to attune to Sophia and aid her in exploring her feelings and experiences in play therapy. Now let's discuss Erikson's psychosocial developmental theory and the case of Jordan. Jordan, a 19-year-old freshman in college, has sought counseling because she feels anxious about choosing a career. How does Erikson's theory help us to understand what Jordan might be experiencing developmentally? Erikson's psychosocial development theory proposes that human development unfolds across the lifespan through a series of stages, each involving a key psychosocial challenge, such as developing trust, forming identity, building intimate relationships, and finding meaning in later life. At each stage, individuals work through tensions between two opposing experiences, such as trust versus mistrust, or identity versus role confusion. Successfully navigating these challenges supports healthy emotional and social development. Counselors can use Erikson's theory to understand how clients' current struggles may relate to developmental tasks or unresolved experiences from earlier stages of life. By considering where clients may be in their developmental journey, counselors can help them explore identity, relationships, competence, and purpose, while supporting growth and resolution of past developmental challenges. When counselors apply Erikson's psychosocial development theory, they use it as a lens to understand how individuals navigate developmental tasks across the lifespan and how unresolved challenges from earlier stages may influence current functioning. Erikson's theory focuses on how people develop a sense of identity, competence, intimacy, and meaning through social relationships and life experiences. Counselors can help clients in a variety of ways. For example, counselors can help clients explore their life experiences and how they have navigated developmental challenges. For clients experiencing identity questions, often during adolescence or adulthood transitions, counselors can facilitate exploration of values, roles, and self-concept. When clients struggle with feelings of inadequacy or inferiority, counselors can help them build competence through skill development and mastery experiences. Which intervention best supports Jordan's development? The best response is B, to help Jordan through an exploration of self-identity and values clarification. Now, let's explore Levenger's theory of ego development and the case of Maria. Maria, a 28-year-old client, is seeking counseling due to interpersonal conflict. She reports feeling easily frustrated by people who break rules, violate her expectations, or have different opinions or values. How might we enhance our understanding of Maria by applying Levenger's work to how Maria interprets the world? Now, let's explore Levenger's theory of personality development. Jane Levenger's ego development theory describes how individuals' ways of understanding themselves, others, and the world become increasingly complex across development. The theory proposes a series of stages in which people move from more impulsive and rule-based ways of thinking toward greater self-awareness, empathy, and the capacity to reflect on internal experiences and relationships. As ego development progresses, individuals develop a deeper ability to understand emotions, tolerate ambiguity, and consider multiple perspectives. Counselors can use Levenger's theory to understand how clients make meaning of their experiences and relationships. By recognizing a client's current level of ego development, counselors can tailor interventions that match the client's capacity for self-reflection, emotional awareness, and perspective-taking, while supporting gradual growth toward more integrated and flexible ways of understanding themselves and others. Levenger's ego development theory helps counselors understand how individuals make meaning of themselves, relationships, and the world as their psychological maturity develops. When applying this theory, counselors should consider the client's current level of ego development, which influences how they interpret experiences, regulate emotions, and understand interpersonal dynamics. Clients at earlier stages may think in more rule-based or self-protective ways, while those at later stages may demonstrate greater self-awareness, empathy, and tolerance for complexity. In counseling, interventions should be developmentally matched to the client's meaning-making capacity. For clients in earlier stages, counselors may focus on building self-awareness, emotional regulation, and perspective-taking skills. For clients in more advanced stages, interventions may include deeper reflective work, exploration of identity and values, and examination of internal conflicts or relational patterns. Across stages, counselors support growth by fostering self-reflection, empathy, and increasingly complex understanding of self and others. What intervention best supports ego development? The best response is B, to help Maria by exploring and engaging in perspective taking. Let's explore Bandura's social learning theory and the case of Dylan. Dylan, a 10-year-old male client, is referred for counseling due to concerns about his aggressive behavior at school. Dylan's teacher has noted that he appears to be imitating the behaviors of teen boys. How can we understand Dylan's behaviors using Bandura's theory? Albert Bandura's social learning theory, later expanded into social cognitive theory, explains that people learn behaviors, attitudes, and emotional responses by observing others, modeling their behavior, and experiencing reinforcement in their environment. Bandura also emphasized the concept of reciprocal determinism, meaning that behavior, personal beliefs, and environmental influences interact and shape one another. A key concept in the theory is self-efficacy, or a person's belief in their ability to influence outcomes and manage challenges. Counselors can use Bandura's theory to understand how clients may have learned patterns of thinking and behavior through family, peers, and social environments. By exploring these learned patterns and the client's beliefs about their capabilities, counselors can help clients build self-efficacy, develop new coping strategies, and practice healthier behaviors through modeling, reinforcement, and guided skill development. Bandura's social learning theory suggests that people learn behaviors, beliefs, and emotional responses through observation, modeling, and reinforcement within their environment. When applying this theory, counselors should consider how clients may have learned patterns of behavior from family members, peers, or cultural influences, as well as how their beliefs about their own abilities, self-efficacy, shape their behavior. In counseling, interventions may focus on increasing awareness of learned patterns, strengthening self-efficacy, and introducing new behavioral models. Counselors might use strategies such as modeling healthy coping skills, role-playing new responses, reinforcing adaptive behaviors, and helping clients reframe beliefs about their ability to change. The goal is to support new learning that promotes healthier behaviors and more empowering beliefs about oneself. Which intervention aligns best with social learning theory? The best response is B, to provide pro-social opportunities for Dylan to observe and practice. Last, we will explore multicultural theories of development and the case of Amara. Amara, a 21-year-old biracial student, has sought counseling due to feeling anxious and hopeless about being disconnected from her family and reserve. How can we apply multicultural developmental theories to deeper understand Amara's experiences? Multicultural developmental theories describe how individuals develop an understanding of racial and cultural identity. Examples include white identity development, Helms; minority identity development, Cross; biracial identity development, Poston; multiple heritage identity development. These models describe stages in which individuals explore identity, confront societal messages, and integrate multiple aspects of self. Specifically, multicultural developmental theories examine how culture, identity, and social context influence human development across the lifespan. These theories emphasize that individuals develop their sense of self within cultural systems and social environments, and that experiences related to race, ethnicity, culture, and systemic inequities can shape identity formation, worldview, and psychological well-being. Counselors can use multicultural developmental theories to better understand how clients' cultural identities and life experiences influence their development, relationships, and coping strategies. By considering factors such as identity development, cultural values, and experiences of discrimination or marginalization, counselors can provide more culturally responsive support and help clients explore identity, build resilience, and strengthen connections to cultural strengths and community resources. Multicultural developmental theories help counselors understand how culture, identity, and social context shape a client's development and sense of self. When applying these theories, counselors should consider how experiences related to race, culture, identity exploration, discrimination, and systemic influences may affect clients' self-perceptions and their navigation of relationships and society. In counseling, interventions often focus on supporting identity exploration, validating cultural experiences, and strengthening cultural strengths and resilience. Counselors may help clients process experiences of bias or marginalization, explore how cultural values influence their worldview, and develop coping and advocacy strategies. Overall, the goal is to promote greater self-understanding, cultural pride, and empowerment within the client's cultural and social context. How should the counselor respond to Amara? The best response is B, to help Amara explore her experiences and the meaning she attributes to such experiences across cultural contexts. In summary, developmental theories are crucial in counseling. They clarify developmental tasks and guide effective interventions. Understanding these theories allows counselors to address each client's unique needs. Think about this question as you reflect on your practice.